FORA.tv. The world is thinking.
What the President has made very clear is anything we do soon to expand coverage, we are going to pay for, either by finding other savings in the budget or new sources of revenue. And so you'll see when we presented our budget, it had a reserve fund for health care reform that involved some savings, it suggested some tax changes we would do, and that's going to be absolutely crucial. And the Congress is very much on board with that, of finding savings right now or new sources of revenue to pay for any expansion that we do. But then we also, the crucial thing is we've got to go beyond that. We've also got to slow the growth rate and costs. And that's why this is such a crucial time when you're doing the expansion of coverage, the important reforms. Let's really do it right and do the kind of things that I suggested, like putting in, changing the way that we pay providers. We find right now we basically pay them for doing more, for volume. And the question is, can you pay them for doing better, right? And to really focus on value over volume. The point I made about technological change. Right now, there's almost no incentive for a smart entrepreneur to think of ways to do things more cheaply. All of our sort of medical advances are more expensive, more complicated, and if we have better incentives in place, we think that we can get actually some crucial innovations that maybe, replace that knee faster. You're in the hospital less, so it's lower cost and many times better for patients. I'll do my centers of excellence example, right? One of the things that you discover, again, I'm not a health economist, but I've had to learn a lot. And what my health economists tell me is, for complex surgeries, places that do them a lot not only have much lower mortality, better outcomes for patients, but actually lower costs. And it makes sense to an economist. You do things a lot, you get better at them. And so one of the things that may be the case is just explaining that to consumers, that going to one of these centers of excellence, you not only get better care, you're actually going to get lower costs, and that could be something that slows it. So there's a range of things. I have to tell you, the Congressional Budget Office has a book about this big of reforms you could do just to the government-provided part of health care that would help to slow the growth rate of costs. And the hard thing is going to be for Congress to really buckle down and do it. Because one of the things that's frustrating about these changes, again, this is policymaker talk, they don't score, which means that when the Congressional Budget Office looks at them, it's hard to say, I know for sure that's going to save this much money. And so one of the things that we'll be asking is Congress to do things that, we think are good, that the experts tell us will help to slow the cost growth in the long run. But right now, the benefits maybe are not things you can write down on paper.